Welcome to Timebeat Breaking News channel. Here are our breaking news today.
1. Taiwan plans $7.5 billion in spending for Covid-19 cases. 2. India government panel recommends a 12 to 16 weeks gap between Covishield doses.
Taiwan plans $7.5 billion in spending for Covid-19 cases. On Thursday, the government of Taiwan announced additional spending of $7.52 billion to support the economy's response to the Covid-19 pandemic, as the country recorded 13 new cases and cash. Increasing the number of rare duplicates spooked the stock market. Taiwan has avoided the worst of the pandemic thanks to early and effective containment measures, including limiting window closures for the most part. To date, only 1,256 cases have been recorded on the island of 24 domains, with the majority being imported. However, following the resurgence of domestic broadcasts late last month, the school and the government mantle were warned, with 16 new domestic cases reported on Wednesday, setting highs on the new day. Chu Tse-ming, general manager of the General Department of Banking, Accounting and Statistics, said it proposed an additional $7.52 billion in activation spending along with the $15 billion already announced, which would need to be international approval. The government pinpoints the source of the latest infections in the country. We link it to previous waves at an airport, hotel and non-company companies at Taiwan's largest airline, China Airlines Limited, using automated DNA. On his Facebook page late on Wednesday, Taipei Mayor Ko Wen-je urged people not to worry. Please don't worry, Taiwan has ample medical capacity, and the number of patients with chronic diseases is not growing fast, wrote Ko, a medical doctor. Taiwan was never completely closed.
India government panel recommends a 12 to 16 weeks gap between Covishield doses. The gap between two doses of the Covishield COVID-19 vaccine can be increased to 12 to 16 weeks. In March it was increased from 28 days to 6-8 weeks for better results. The National Technical Advisory Group on Immunization also said pregnant women can choose their vaccine, and lactating women will be eligible after delivery. Currently, neither is eligible to get the shots. These recommendations will be sent to the National Expert Group on Vaccine Administration (NEGVA) for approval before they are implemented. Dr. C.N. Ashwath-Narayan, the Deputy Chief Minister of Karnataka, one of several states to flag low vaccine stocks, tweeted, "Extending the gap assists the government in carrying out the inoculation program effectively." Many countries follow this practice. In Canada, the gap is 3-4 months. In the meantime, India is making all efforts to increase supply and explore local production options. Protection was enhanced if the second dose of Covishield was administered between 6 and 8 weeks, but not later than that. So, the widening of Covishield dosage intervals has been linked to increased efficacy. A study published in the international medical journal The Lancet on February 19 claimed a 26.2% increase, from 55.1% to 81.3%, if doses were spaced 12 or more weeks apart. However, recommended changes to intervals also come amid an acute shortage of doses as the manufacturer, Serum Institute of India, struggles to keep pace with demand.
Thank you for watching. We help you stay up to date all the news hourly. Please subscribe our channel to follow up the latest one.